I want to tell you about a woman I treated 3 years ago. 69 years old, retired school principal. Sharp, independent, walked her dog every morning without fail. She came to me not because of chest pain or shortness of breath. She came because she kept waking up at 3 in the morning every single night, wide awake, heart pounding, drenched in sweat. She told me she had seen 2 doctors already. The first one said it was anxiety, gave her a prescription for sleep medication. The second said it was menopause, even though she was nearly 70. Told her to try melatonin. Neither one ran a single cardiac test. Neither one asked the right questions. When I finally got her into my office and we ran the full workup, what we found stopped me cold. Her heart was in serious trouble. Not someday trouble, right now, trouble. And the only warning sign her body had been giving her for months was waking her up at 3 in the morning. I am Dr. Maya Okafor. I am a cardiologist with over 20 years of experience treating hearts that have been quietly failing while their owners slept. What I am about to share with you today is something most doctors simply do not have time to explain in a 15-minute appointment. But after 60, it could save your life. Let me start with something most people have never been told. Your heart does not rest when you sleep. It changes how it works. During the day, your cardiovascular system is running at full capacity. Your blood pressure stays elevated to keep up with movement, stress, digestion, everything your body demands of it. At night, something different is supposed to happen. Your blood pressure should drop by 10 to 20%. Your heart rate should slow. Your arteries should relax. This is your body's built-in repair cycle. It is when your blood vessels recover from the stress of the day. It is when your heart gets the closest thing it will ever get to a break. But after 60, that system becomes less reliable. The arteries stiffen. The pressure regulation gets sloppy. The hormones that used to protect your heart during sleep start to weaken. And the margin between safe and dangerous gets thinner every year. Here is what makes the hours between midnight and 6 in the morning so critical. During the day, your body has backup systems. It can compensate, it can adjust. At night, most of those systems go quiet. Your body is running on a skeleton crew. And if something goes wrong at 3 in the morning, there are fewer defenses standing between you and a serious cardiac event. This is not theory. This is what I have seen over and over again in my practice. The majority of heart attacks and strokes in people over 60 do not happen during a stressful meeting or while shoveling snow. They happen in the early morning hours, while people are lying still, while the house is dark and quiet, while nobody is watching. So why 3 in the morning specifically? Your body runs on an internal clock. Around 2 to 4 in the morning, several things happen at once. Cortisol, your stress hormone, begins to rise in preparation for waking. Your blood becomes naturally thicker and stickier because you have not had fluids for hours. Your blood pressure, which should be at its lowest, sometimes surges instead. In a healthy young person, none of this matters. The body handles it effortlessly. But in a person over 60, with stiff arteries, with plaque building quietly inside coronary vessels, with blood that is already prone to clotting, this combination becomes genuinely dangerous. A pressure surge hits an arterial wall that cannot flex. A thickened blood clot forms in a vessel that is already narrowed. And that is how someone goes to sleep feeling fine and never wakes up. Now let me tell you what waking up at 3 in the morning actually means. Because most people dismiss it. They blame stress, they blame the coffee they had at lunch, they blame getting older. And sometimes those explanations are correct. But sometimes, especially after 60, your body is trying to tell you something your conscious mind cannot detect. When your heart is under stress during sleep, your brain knows. It registers the oxygen drop, it feels the pressure surge, and it does the only thing it can do to protect you. It wakes you up. That sudden jolt at 3 a.m, the racing heart, the feeling that something is wrong, even though you cannot name it, that may not be anxiety. That may be your body sounding an alarm. I have seen this pattern dozens of times. A patient comes in complaining about poor sleep. They have been waking up between 2 and 4 in the morning for weeks or months. They feel their heart pounding. Sometimes they are short of breath. Sometimes they are sweating. And when we finally run the right tests, we find one of several serious conditions that were hiding in plain sight. The first and most common is nocturnal hypertension. This is when your blood pressure refuses to drop at night the way it should. Instead, it stays high or it actually spikes during sleep. You cannot feel it happening. Your morning blood pressure reading at the doctor's office will not catch it. Everything looks normal during the day, but at night, your heart is working overtime. Your arteries are under constant stress, and your risk of stroke and heart attack goes up dramatically. The only way to catch it is with a 24-hour blood pressure monitor that tracks what happens while you sleep. If you are waking up at 3 a.m. with a racing heart, ask your doctor about overnight blood pressure monitoring. Do not accept a daytime reading as proof that everything is fine. The second condition is sleep apnea, and I cannot stress this enough. Sleep apnea is not just a snoring problem. It is a cardiac emergency happening over and over again every single night. When you have sleep apnea, your airway collapses while you sleep. You stop breathing, sometimes for 10 seconds, sometimes for 40. Your oxygen drops sharply. Your brain panics and fires off adrenaline to restart your breathing. Now imagine that happening 30 or 40 times in a single night. Every episode sends a spike of stress hormones through your bloodstream. Your heart rate surges. Your blood pressure jumps. Your blood vessels constrict. Night after night, year after year, this is doing real measurable damage to your cardiovascular system. Sleep apnea triples the risk of heart attack. It is directly linked to atrial fibrillation, which itself dramatically increases stroke risk. And the terrifying part is that most people who have it do not know. They think they are just tired. They think they are just getting older. They have no idea their heart is being battered every single night. The warning signs are not always obvious. Yes, loud snoring is one, but also waking up with headaches, feeling exhausted after what should have been a full night of rest, needing to use the bathroom multiple times during the night, waking up with a dry mouth or a choking sensation. If any of those sound familiar and you are over 60, please get evaluated. This is not optional. This is part of taking care of your heart. The third condition I see behind these 3 a.m. wake-ups is silent ischemia. This is when the heart muscle is not getting enough blood flow, but you do not feel the classic chest pain. After 60, the nerve signals that would normally scream at you to pay attention become quieter. The pain pathways dull with age. So instead of feeling crushing chest pain, you feel restless. You feel your heart racing. You feel a vague sense that something is off. And you wake up. Silent ischemia is far more common than most people realize, especially in older adults and in women. I have treated patients who had significant blockages in their coronary arteries, and the only symptom was disrupted sleep. No chest pain, no arm numbness, no dramatic collapse like in the movies. Just a body that kept waking itself up because the heart was quietly struggling. The fourth possibility is atrial fibrillation, an irregular heart rhythm that affects millions of people over 60. During an episode of atrial fibrillation, the upper chambers of your heart quiver instead of pumping efficiently. Blood pools, clots can form, and those clots can travel to the brain and cause a stroke. Atrial fibrillation often shows up at night. It can cause palpitations that jolt you awake. You might feel your heart fluttering or pounding. You might feel dizzy or lightheaded in bed. And because episodes can come and go, a standard electrocardiogram during a daytime office visit might miss it entirely. If your 3 a.m. wake-ups come with a sensation that your heart is beating irregularly, tell your doctor. Ask about an extended heart monitor that you wear for a week or longer. One test could catch what a brief office visit never will. Now, here is what I need you to understand. I am not telling you this to frighten you. I am telling you this because I have stood in hospital rooms at dawn talking to families who lost someone overnight. Someone who had been waking up at 3 a.m. for months. Someone who told their doctor about it and was handed a sleeping pill. Someone whose heart was sending a signal that nobody listened to. That signal is not random. After 60, your body does not waste energy waking you up for no reason. If it is pulling you out of sleep in the middle of the night with a pounding heart, shortness of breath, or drenching sweat, something is happening. And it deserves a real investigation, not a pat on the back and a prescription for better sleep hygiene. So what should you do? First, pay attention to the pattern. Once or twice in a month means nothing. But if you are waking up between 2 and 4 in the morning regularly, 3 or more times a week, and you feel your heart racing, or you are short of breath or sweating, write it down. Date, time, what you felt. Bring that record to your doctor. Second, ask for the right tests. A standard blood pressure check in the office is not enough. Ask about 24-hour ambulatory blood pressure monitoring. Ask about a sleep study if you snore or feel exhausted despite sleeping. Ask about an extended cardiac monitor, not just a 10-second electrocardiogram. Third, look at your evening habits, because what you do before bed directly affects what happens to your heart at 3 in the morning. If you are eating a heavy meal at 8 or 9 at night, your heart is working overtime to digest food when it should be resting. Studies consistently show that eating within 2 to 3 hours of sleep raises nighttime blood pressure and increases cardiovascular events during sleep. Finish your main meal by 6 or 7 in the evening. If you need something later, keep it light. Vegetables, a small portion of protein, not a full plate of pasta and bread. Your heart will thank you for it. Fourth, talk to your doctor about when you take your blood pressure medication. This is one of the most important conversations you may ever have, and most people over 60 have never had it. If you take your blood pressure pills in the morning, they may be wearing off by the time you need them most, during those dangerous overnight hours. There is strong evidence that taking blood pressure medication in the evening instead of the morning significantly reduces cardiovascular risk during sleep. The Hygia chronotherapy trial showed exactly this. One simple change in timing, same medication, same dose, dramatically different protection. Ask your doctor if evening dosing makes sense for you. That conversation takes 2 minutes. It could be the most important medical discussion you have this year. Fifth, do not go to bed dehydrated. I know why many people over 60 stop drinking water after dinner. They do not want to wake up at 2 in the morning to use the bathroom. I understand that completely. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a real risk factor. When you are dehydrated, your blood becomes thicker. It does not flow as easily through your vessels. Combine that with the naturally slower heart rate during sleep. Add in arteries that may already be narrowed, and you have a recipe for clot formation in the early morning hours. 1 glass of water before bed, 8 ounces. That is all it takes. Keep another glass on your nightstand. 6th, check your bedroom temperature. This sounds almost too simple to matter, but your cardiovascular system has a preferred range between 18 and 22 degrees Celsius. That is roughly 65 to 72 Fahrenheit. Too warm and your body works all night to cool down. Blood vessels dilate, heart rate stays elevated. You sweat and lose fluids, which brings us right back to the dehydration problem. Too cold and your blood vessels constrict sharply. Blood pressure rises. Your heart pushes against more resistance. For someone with existing heart disease or high blood pressure, that overnight pressure increase is not trivial. 1 thermostat adjustment, real protection, 0 cost. 7th, if you snore, take it seriously. I tell my patients this directly, and I mean it. If you snore heavily and you are over 60 with any history of heart problems, getting evaluated for sleep apnea is not a suggestion. It is part of your cardiac care. The treatment, usually a CPAP device, is not glamorous, but the data on what it does for heart health is remarkable. Lower blood pressure, fewer episodes of atrial fibrillation, measurably reduced cardiac risk. And here is one simple thing you can do tonight. If you snore or have been told you stop breathing during sleep, try sleeping on your side instead of your back. Back sleeping worsens airway obstruction dramatically. A positional change alone can reduce apnea episodes significantly while you work toward a proper evaluation. Let me come back to my patient, the 69-year-old retired principal who kept waking up at 3 in the morning. When we ran the full workup, we found 3 things happening simultaneously. Her blood pressure was spiking during sleep, reaching dangerously high levels that her daytime readings had never shown. She had moderate sleep apnea that had gone undiagnosed for years, and she had early signs of reduced blood flow to her heart muscle, silent ischemia with no chest pain. Her body had been waking her up every night trying to tell her what 2 previous doctors had missed. We started her on evening blood pressure medication. We got her fitted for a CPAP device. We adjusted her cardiac medications based on what we found. We changed her evening routine. Earlier dinner, glass of water before bed, bedroom temperature set properly. 3 months later, she came back to my office and said something I will never forget. She said, "Dr. Okafor, I sleep through the night now. I had forgotten what that felt like." Her blood pressure was stable for the first time in years. Her heart function had improved measurably, and all of it started because she refused to accept that waking up at 3 in the morning was just part of getting older. Here is what I want you to take from everything I have said today. Waking up at 3 in the morning is not normal aging. It is not just stress. It is not something to fix with a sleeping pill and move on. After 60, it may be the only warning your heart is giving you. And if you ignore it, you may not get another one. You do not need to panic. You need to pay attention. Write down the pattern. Bring it to your doctor. Ask for the right tests. Look at your evening habits. And do not let anyone dismiss what your body is telling you without a proper investigation. Your heart has been beating for you every second of your life without ever asking for a break. The least you can do is listen when it tries to tell you something, especially at 3 in the morning. I am Dr. Maya Okafor. Take care of your heart. Take care of yourselves. And please, if someone you love is over 60 and keeps waking up in the middle of the night, share this with them. It might be the most important thing you do for them today. Everything I have shared here is general medical information based on current cardiovascular research and my clinical experience. Your situation is unique. Before making any changes to your medications or care, please talk with your own physician who knows your full medical history. That conversation is always worth having.